name is Dallas Nicewander. I'm in nursing 1119. I'm going to do a room scan. Alright, and I got consent from my patient to be recorded and submit to my teacher. So first I'm going to check in my patient's chart for order, allergies, their baseline vital signs. I'm going to perform hand hygiene. I'm going to gather my supplies. I've provided privacy. My name is Dallas. I'm going to be your student nurse today. Could you give me your name and date of birth?
Shelby Tiffany, 923 on the 7th.
Alright, so today I'm going to be doing a comprehensive physical exam. Do you have any questions about that? Alright, where are you?
EMC's A,
What year is it?
2022.
And what's your full name?
Shelby Tiffany.
Alright, and my patient is smiling, she's pleasant. What did you have for breakfast this morning?
Pop-Tart.
Alright, and do you have any brothers or sisters?
I have one brother and 3 sisters.
Alright, so now what I'm gonna have you do is I want you to start right here. And I want you to take 5 steps and then 5 steps back. So I'm assessing her gait. It looks normal. Everything looks great. Alright, then come back this way. So now I want you to put your feet together, your arms at your side. I'm gonna assess with the eyes open. So now I want you to close your eyes. Now we do this for 20 seconds. You're gonna open your eyes now. So since there's no swaying, that was a negative number test. So now what I want you to do is I want you to follow my finger. I want you to touch your nose and then touch my finger. Alright. Alright, so now I want you to take your heel, start at your ankle, go up to your knee, and back down. And then the other side. Alright, so now if you'll turn to the side for me, I'm assessing her posture. Everything looks great. Now, if you could turn your back towards me, I want you to cross your arms and bend over slightly. Alright, I'm assessing for any curvature, any tenderness. Alright, so that looks great. So if you'll sit down for me. Alright, so now what I'm going to do, I would have like alcohol swab. My patient would not know this. Would you close your eyes? I'll put it under her nose. What did you smell?
An alcohol swab.
Alright, so now we would do the smelling eye chart. So what the technique is, we'd have the chart 20 feet away. They would start at the top and read as low as they can. And they would do one eye at a time, and then we would also let her keep her glasses on for this. Alright, so now what I want you to do is I want you to look over the shoulder. Excuse me, could you take your glasses off? Thank you. Alright, so now. Alright, now look over the shoulder. Alright, and then give your eyes a rest for a second. So now I want you to follow my pen light. Alright, perfect. Alright, so you can put your glasses back on now. Alright, so now I want you to close your eyes and I want you to tell me what part of the face I'm touching.
Forehead. Cheek. Cheek. Chin.
Alright, no brows now. Alright, so smile for me, frown, puff out your cheeks, and move your eyebrows. Great. Now I want you to stick your tongue out and say, ah. Alright, everything's nice and symmetrical back there. Alright, and then shoulders, shrug them up for me. Alright, stick your tongue out. Alright, so now I want you to cover your ear, and I'm going to whisper something now. I want you to say it out loud for me.
1, 2, 3.
Alright, now cover your other ear.
ABC.
Alright. So all your cranial nerves are intact. Everything's great. So now we're starting musculoskeletal. Alright, so we're going to do range of muscle and muscle strength. So first I want you to stick your arm out like this, and I want you to go all the way up for me. Alright, and now I'm going to apply some resistance and go up for me. Alright, and then now I want you to hold your arm like this and lift the elbow up for me. And now with resistance. Alright, and then for your wrist, I want you to make a fist and go up and then down And now with resistance, go up for me and then down. All right, I'm gonna go ahead and check the joints. So if you roll that shoulder for me, and then this elbow, and then wrist, and then I would do this bilaterally on the opposite side. All right, so now I want you to flex that leg out for me. And with resistance, flex that out for me. And then foot, flex your foot up, and then down, now back up, and down. All right, I want you to flex that knee out for me again. All right, and then roll your ankle. All right, and then now I'm gonna assess muscle tone, so go down. All right, she has normal muscle tone. So now I want you to close your eyes, and I have something that's soft. You let me know when it's touching you, okay?
Yes. 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 Mhm. Yep. Mhm. Yep. Yep.
All right, and then I have something else that should feel dull.
Yes. Touch. 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 Yep. 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 Yep.
All right. So now I want you to hold your arms out, and then can you flip them over for me? All right. So now I'm gonna hold out my two fingers, and I want you to grip my fingers increasingly until you can do it all the way.
Okay.
All right, that's great. And I also assess the finger flexion at that point. So now I'm going to assess your radial pulse, and we would do the affected side with the unaffected so we can compare, and I would do that bilaterally to note the symmetry. And then I would also do the pedal pulses. We would normally have them remove their shoes and socks, but for video purposes we're not doing that, but that's right across the top of the foot. All right, so everything looks great. We're done now. So I would place my patient back in a safe position, make sure her call light's within reach. I would perform my hand hygiene and then document, and then we'll do a rib scan.